Hi guys, this is the Gastrointestinal Disease and Disorders Project over Barrett's Esophagus by Kimberly in Italy. Barrett's esophagus is the eroding of esophageal tissues. These tissues will begin to lick the intestines or the lining of the stomach, and it mostly affects the lower esophagus and going into the stomach, and also it can affect the stomach going into the duodenum. So the tissue is eroded by stomach acid, which is caused by gastroesophageal reflux disease, or GERD, or GERD, and 10 to 15% of people with GERD will get Barrett's esophagus. This picture basically illustrates how, like it says, a normal lower esophagus looks, and then one with Barrett's esophagus. So you can see the erosion and the discoloration is from the stomach acid that has been forced back up into the esophagus after eating whatnot. Anyone that's older than 50 years old, white men, especially over the age of 40, are at high risk of getting Barrett's esophagus. People that are obese, smokers, and then if you have a family history of acid reflux or esophageal cancer, you're more at risk, even though this is not a genetic disease. The symptoms that are associated with Barrett's esophagus are basically the same symptoms of GERD. So those would be heartburn, sour taste in the mouth, burning sensation in the back of the throat, nausea, and chronic cough. And then this picture shows basically where the stomach acid would be after eating and where it would get passed back up into the esophagus, right where the lower esophageal sphincter is, and then above that the esophagus. So that stomach acid goes back up and irritates that, which can cause the sour taste in the mouth, the burning sensation, and the nausea. So Barrett's esophagus is diagnosed by an upper endoscopy or biopsy, since there aren't really any symptoms that differentiate Barrett's esophagus from the acid reflux. So the upper endoscopy is basically illustrated in this picture. They take a long flexible tube, put it through your mouth and down your esophagus. At the end of it, there's a small camera, and that camera basically snaps pictures and shows on a screen the tissues of the esophagus, how it looks. It's pushed down to the lower esophageal sphincter to reveal the eroded tissues, and then right at the duodenum into the small intestine as well. Treatment for Barrett's esophagus can consist of some lifestyle changes, such as avoiding fatty foods, chocolates, caffeine, spicy foods, and peppermints. You could also lose weight, since obese people are more at risk. If you sleep with the head elevated so that it doesn't come back up through the mouth, and waiting 3 hours before laying down after eating so that it settles and actually goes down the intestines, less risk of coming back up. Medications for treatment would be antacids, H2 blockers, promility agents, and proton pump inhibitors. And this picture is basically some over-the-counter medications that we're familiar with that are basically used for acid reflux: Tums, Rolaids, also Prilosec OTC, stuff like that. Prognosis: you could end up developing esophageal cancer, but less than 1% of people get that. You can lead a normal life with some slight lifestyle changes if that helps. If not, then you can have lifelong medications. You could also have a surgery to basically try and rebuild the eroded tissues in the lower esophagus, and then you would still take medications for that. So our quick check questions. Number 1, what is the purpose of an upper endoscopy? The purpose for Barrett's esophagus is done to observe the eroded tissues of the lower esophagus and see if there's any cancerous cells within those tissues. Question 2 is true or false. Every person that develops Barrett's esophagus will have a prognosis of having esophageal cancer down the line. That answer is false. Less than 1% of people that are diagnosed with Barrett's esophagus result in having esophageal cancer. However, if there is a history in the family of esophageal cancer, then you would be more at risk of getting that later down the line. Question 3 is true or false as well. Barrett's esophagus is strictly a genetic disease. That is false. Although if the patient has a family history of acid reflux or esophageal disease, then they are more at risk of developing Barrett's esophagus, as mentioned earlier. And then describe the process of an upper endoscopy. So the upper endoscopy will consist of the doctor inserting a long flexible tube down the mouth, through the throat and stomach, down to the beginning of the small intestines, or the duodenum. And this tube has a camera on it that will show the eroded spots of the esophagus, check for cancerous cells.